Now let's talk about a very important concept, that of current of injury. Now what is current of injury? Normally there are stages of ventricular systole, ventricular diastole. In systole and diastole, they are the contractile and the relaxation phases respectively. The intervals of time when depolarization is happening, and there are times when neither is taking place, when the heart is either completely depolarized or when it is completely repolarized. A current of injury is produced when part of the muscle is not repolarized at all. It never repolarizes. For example, if this is the right and this is the left ventricle and this is the base of the left ventricle, and somewhere in this area there was basically an infarction, and because of the infarction there was damage dealt in this area, but the damage was not severe enough to cause necrosis, but it did damage the base enough that this part, its membrane, was damaged to such an extent that repolarization could not take place, right? This can also be because of some sort of an infection or some sort of a trauma directly to the heart or whatever that would damage the membrane, muscle membrane, because that is the one that is largely responsible for these membrane potentials. Now what happens is that we have the P wave showing when the atria is in the process of depolarizing but not has depolarized completely. Then we have the QRS complex showing when the ventricles are depolarizing but not completely depolarized. Then we have this part over here which is depolarization, which is fine when all of it is depolarized. Then we have the T wave in which repolarization happens. And then we have the TP segment, which shows that the ventricles are and the atria in fact are both in depolarization stage. And at this point, in this TP segment of variable duration, it is an isoelectric line at zero level, because when something is completely repolarized there isn't any electrical potential. The problem actually occurs at this point. Return to baseline level will not happen at the TP point, because there will be one part that will always be depolarized. It will always be sending out a vector, so baseline will not be achieved. Now this is a bit difficult to tell if there is an elevation at this point or not, which would be a current of injury. So before you can kind of understand or locate where the current of injury is, you have to figure out where the J point is. The J point is that point where whether current of injury exists or it does not exist, J point is the point at which zero baseline is achieved, and it is also achieved when current of injury exists, because of the point where the whole of the ventricle is depolarized. Obviously this will also be depolarized because it is always depolarized. So that point right after the QRS interval, you mark a point as J, and you know that this is where we are at zero baseline, and then you compare this segment with this one to figure out where this is happening. Now how do you know where the infarct is? By using the leads V1, V2. They're placed at different spots, and different leads, they look at different areas of the different parts of the heart, different aspects, so you kind of know where the infarct is located. I'm hoping this is helpful.